Well, good evening, everyone. My name is Jane Larson. I'm the school social worker here at the high school. I'm also the chair of the Douglas County Drug Prevention Coalition. So on behalf of myself and the rest of our partners here, the district, and our community partners, I want to welcome everybody and thank you for being here with us this evening. Bringing this group of people together has been something we've been working on for a number of months now. A number of us at the school district got together at the end of the school year last year and wrote a $15,000 grant to DPI to address opioid issues in our school and in our community. So we found out in November that we had the grant, and we have put our heads together and been working since then to try to pull this event together. So we're very thankful for all of you, our experts, who were willing to join us tonight to have this discussion. We realize that opioid use, drug use, is not only a growing issue in our community, but in the nation as a whole. But we felt like it was important for us to bring together folks tonight to talk about what is happening in our own community, make sure that we're kind of all on the same page about what's happening, what is the experience here in Douglas County and in Superior, what do we have available in our community to address the opioid epidemic, and who are our partners who can come together to work. It's going to take all of us. We need everyone working together to make a difference. So our hope is that this evening you will leave with some maybe new awarenesses, some education, maybe some things you didn't know, and some ideas about what we can do individually and collectively to come together to address the issue. So again, thank you everyone for being here. We're really grateful for your presence, and for those of you who may be not here but are watching at home on the live stream, thank you for joining us as well. So maybe just to get started, to make sure we are all understanding and on the same page, is there anybody on the panel who would like to talk about what an opioid is, and maybe what are some of the street or slang names that are used that people might hear about that? So is there anybody who would be willing to address that question? Dr. Ripley, thank you. Nope.
Yours is on.
Okay.
Perfect, thank you. This is a good question for me. I'm a internal medicine physician and addiction medicine physician, so I can take this one. An opioid is a drug that works in the brain, and opioids tend to be really potent medication for pain, so they treat pain really well. And in addition to treating pain, they can also cause euphoria, so people get high on them, and they have a number of other side effects. So they treat pain really well, but in overdose, so if someone takes too many opioids or too high of a dose of opioid, they can cause you to decrease your breathing or stop your breathing. So in overdose or in too much of an opioid, they cause you to stop breathing, which can kill you essentially, right? And opioids come in all different forms. So there are prescribed opioids. That would be medications like oxycodone, hydrocodone, morphine. Fentanyl is a medication that we can prescribe. But in 2024, many of the opioids that people get are illicitly made. And in the past, opioids were made from things like heroin, which was made from poppy, and that was expensive and hard to make because you needed plants. And now, most of the illicit drug supply, which is what many young people have access to, are drugs that are illicitly manufactured. And so these can be made from chemicals, and they can be mass-produced. And these are much, much more potent than what we had in the past. So some names for those might be Percocet 30s, or dope, or those are kind of the names that I know of off the top of my head. And probably the police who are here might know more of the illicit names for them, but those are kind of the main ones.
Thank you.
Yeah.
I'm going to introduce, I don't know, is there anybody else who would like to add anything to that, to what Dr. Ripley said? Leanne?
I think we should talk about how they may look. A lot of people just think that most opioids, they think of heroin. That's what mostly comes to mind, which people also refer to as H. But a lot of these synthetics, such as fentanyl, are actually being cut into other substances. For example, marijuana is a big one that has a lot of issues where people are cutting fentanyl, especially the vape cartridges, where not purchased legally from a store, but a lot of people make their own cartridges. And I've seen and heard of multiple occasions of individuals who have came in contact with something as simple as a vape cartridge, and that has been cut with fentanyl. A lot of other issues we see in our community specifically are pressed pills. A lot of people, even our youth, are thinking they think they're purchasing a Percocet or an Oxy, some kind of a legal medication. But in reality, a lot of those pressed pills are straight fentanyl, and they will end someone's life immediately if they don't have proper support on hand, such as Narcan. But I always want to reinforce that the fentanyl is not just heroin. It is being cut into other street drugs, even cocaine. There's a lot of, I've heard specifically in the role I work in, even cocaine is being cut with fentanyl, and then marijuana. Even methamphetamine, a lot of people never considered meth to be an opioid, but in our community, from the experience I have with my profession, majority of the meth we see here in our community is also cut with fentanyl, which is a very deadly combination.
I'll build off that. We've seen a number of cases in the last couple of years where, like you said, people think they're getting perks or M30 pills, but really those pills are disguised to appear like fentanyl. So I've seen terms like blues, perks, M30s, and I've seen cases of people who have died thinking they're taking one thing and wind up taking fentanyl instead.
Yeah, thank you. I think I'm glad that we're talking about this evening, because I think there's a lot of misconceptions about what is available in our community and what's reality and what do people think they may be getting. We'll talk about some of that more as we go on. At this time, I'd like to introduce Carrie Saunders, who is one of our principals here at the high school, and then we would like to introduce all of you as your panelists as well.
Thanks, Jane. If each of you could just briefly describe your role in addressing opioid misuse in Douglas County, that would be very helpful for us. Yeah.
My name is Dr. Melanie Ripley. I'm an internal medicine physician and recently board certified in addiction medicine. So I started working at Essentia in 2020, but I grew up in northern Minnesota, so I know the sort of landscape. And when I moved here, I worked in general medicine, and then general medicine at Essentia has a lot of addiction care that's integrated in the care. So it's important just because I don't take care of kids in my general role, but so I see mostly adults. But in my addiction role, I can definitely see kids. So worked as an internal medicine physician and worked as a opioid medical director, so working a lot in opioid stewardship in the hospital setting at Essentia. And then in February of this year, we started our addiction consult service, so seeing patients who are hospitalized at Essentia who come in with substance use disorder. So seeing, just a wide range of patients who struggle with a substance use disorder or addiction in the hospital. So worked as kind of general medicine, also working in opioid stewardship, trying to prevent, opioid misprescribing, and now working, kind of coming full circle and working as a addiction medicine doctor. And just, I'm super honored to have this opportunity to come here, because I think working and, living in the community, working with the community and working with all of these fine people is just a way for us to all collaborate. So thank you for this opportunity.
My name is Mark Fruehauf. I'm the district attorney for Douglas County. This is my 8th year serving as district attorney. My role, or my office's role in terms of combating opioid use, is in criminal prosecution. So in Wisconsin, it's illegal to possess fentanyl or opioids without a prescription. It's illegal to distribute them without a prescription. Wisconsin also has what's called len-bias homicide or reckless homicide, where if you illegally transfer or sell fentanyl to another person and that person dies as a result of that use, that is a form of homicide in Wisconsin. So we prosecute those cases, but in addition to that, we do try to work with the other agencies and community partners in proactive ways before cases ever get to my office. That can include the Pathways to Hope program, which I think we're going to hear more about from our police department representatives. And the DA's office is also part of a multidisciplinary drug court or treatment court that's been in service for a long time, that does really good work with a lot of people that have real serious addiction issues in the community. So that's my office's role.
Hi, good evening. My name is Leanne Eisenhower, and I work at an agency called Vivant Health, and I have a little bit of a different role than some others up here on the stage. At Vivant Health, we specialize in HIV care and prevention services. And so my role is I'm a medical case manager, and I'm also a prevention worker. But tonight we're here more for the prevention work we do. So at Vivant Health, we're not considered a primary prevention effort, but what we do is through our prevention efforts to reduce the spread of infectious diseases, we have programming to combat that. So for example, we offer overdose education training. So our agency is one of the entities in our region where an individual would be able to obtain the overdose medication, which is known as Narcan. We also provide the training for that. So we come in at a little different point than primary prevention. We're there for a person going through with their current struggles. We're there to offer support, resources, access to treatment, support, and in addition, the overdose education.
Good evening, I'm Jen Stank. I'm the Coordinated Response Specialist for the Superior Police Department. I am an embedded civilian employee. I work alongside our patrol officers. I help manage our Pathways to Hope program, which is a grant-funded program. It's for anybody who lives in Douglas County who's struggling with a substance use disorder. You must be 18 years of age and live in Douglas County, and we can pretty much we'll get you connected to Lake Superior Community Health, which is a community partner here that we partner with. With our department, we're always trying to come up with new ways to respond to what's going on in our community. And Officer Robinson, can you grab this for me? We started the Naloxone Plus program. So our department responds to all the overdose calls. And we also leave Narcan behind. All of our officers carry Narcan. And we leave these bags behind for those who may be suspected of being subject to an overdose. In the bag is Narcan, fentanyl testing strips, resources for our Pathways to Hope program and Lake Superior Community Health, and some other resources with my contact information in there. So if there's anyone in our community who is struggling with a substance use disorder, they can get in touch with me and we can hopefully get them some help. Thanks, Ron.
You're welcome. Hello? Can you hear me? Okay. I'm Officer Robinson with the police department. I primarily have worked on patrol. I recently started as our deflection resource officer. We work together on what's called our Core Plus team, which is community outreach and response. I deal with the Pathways and the Naloxone Plus, but overall public safety, and obviously opioid misuse is a public safety issue. So I think I would say, along with those things, I think recognizing signs and symptoms of opioid use. I mean, I think all of us have probably Narcan more people than we can count. It's a multifaceted approach. I guess it's not easy to explain exactly how I work to prevent opioid misuse because it's on the front end and the back end. So.
Okay. Good evening. My name is Dave Longsdorf. I'm the Deputy Director for Douglas County Health and Human Services and the Supervisor of the Adult Services Unit. The Adult Services Unit includes alcohol and drug intervention as well as mental health and adult protection. And I mention that because they all kind of come together in a lot of other things that we do. We really have two kind of major areas as far as adult services is concerned. We do kind of the statutory side of things, which is we are mandated to provide detoxification for individuals that are undergoing some sort of chemical reaction, as well as we conduct what's called civil commitments for people who are drug addicted, mentally ill, et cetera. So that's kind of the statutory side of things, what we do. We also do a lot in prevention. We receive funding from both the federal government and the state, and we use those funds in a best practice approach to try to find ways to help, for lack of a better word. So we've done everything from taking the opioid reconciliation funds, pulled together a group of professionals and community and start to look at how to use those funds to best support the community. We've used block grant funds to sponsor, actually we sponsored a youth prevention program right here in the school, Lionheart. We have done sharps collection. I've bought more Narcan than I can even think of for law enforcement, the fire department, a number of other shelters, et cetera. And we've done a number of speaking engagements. We also are kind of the gatekeeper to inpatient treatment for those people on medical assistance. And when I say gatekeeper, it's kind of a wide open gate. We try to help as many folks as we can. So there's actually a social worker assigned who will work with that person, get what they need to get, and then make the referral and try to kind of walk with them through the entire process of inpatient. And that's the bulk of what we do.
Thank you. Thank you for, again, being here. Thanks for introducing yourselves and talking a little bit about what you do and what your role is in addressing opioids in our community. Most of you talked about some of the strategies that you use in response to the opioid misuse in our community. I'm wondering if there's anything else at this point that any of you would add to that question about other strategies you might use in response to misuse. I think you answered that pretty well, but if you have other things to add, please do.
I guess one thing I would add is that I'm an addiction medicine doctor, so I treat people who have addiction, but there's an important distinction here is that children or kids commonly use or experiment drugs. So there's, in my mind, these are kind of, they're related but different, right? So addiction is a brain disease when someone uses a drug and they start to exhibit behaviors where they, these behaviors seem kind of incomprehensible to people who aren't familiar with what addiction is. So that's one thing, and I can talk a little bit about that. But the problem that we have of opioids being prevalent in our community is that many children, kids, high schoolers, teenagers use substances, they experiment with them. It's super common, right? Something like 50% of teenagers have used alcohol by the time they graduate from high school. So it's common. And the problem that we have now is that fentanyl is so potent and so accessible that you can take one pill and it can kill you. That's different from addiction. And so recognizing this, like knowing that this is a problem, these pills are a problem and they're accessible, and knowing that we can have Narcan available, we can have test strips, we can educate, we can try to talk about it, destigmatize it. But the problem of addiction is different. And so addiction is, like I said, it's a brain disease. And when people have an addiction to opioids, we call that opioid use disorder, right? It's a medical problem. And there's treatment for it. There's really good treatment for it. We have really good medications to treat opioid use disorder. So when people cross from experimenting into addiction, there's a diagnostic criteria. I won't bore you with those details, but my job mostly is to treat people who are kind of at the, when they get to addiction. So I think what I want people to know is that we have that at Essentia. It's integrated into primary care. It's accessible. We have a 24-hour nurse care line where you can call a number and the nurses can get you in. You should be able to see your primary care doctor, have those medications offered to you. We have tons of community resources, and we have really good medications for it, right? And it's a disease, and it's super stigmatized, and stigma kills people, right? So if we talk about it and recognize that it's a disease, just like any other chronic disease, and we have good medications for it, then, we can help people. We can help patients and families and communities.
Cool, thank you. I just have a question for you. So when we talk about the medication being available, we talked about youth and adults. It's available for youth as well as adults, correct?
Yeah, absolutely.
Great. Thank you. Leanne?
Hi, so just talking more about the work we do at Vivant Health. So we believe in the terminology of harm reduction. I'm not sure if many of you out there have heard of the terminology harm reduction. So harm reduction is a different approach on how to work with people going through addiction. So the best way I can describe harm reduction in 20 seconds or less is harm reduction is a set of principles where we understand somebody is going to make choices that we do not want them to do. And harm reduction is the belief that we, as public health and as a society, we provide resources and tools to have an individual make those choices, but as safe as possible. And that really is what harm reduction is, and that's just a whole way of changing our way of thinking. Instead of thinking automatically to punishment, we have to think of, well, we know this person is going to make these choices. Nobody wants to see somebody use these substances, but how can we have this done as safe as possible? And so at our agency, Vivant Health, we also offer fentanyl testing strips. Also, Jen mentioned that the PD does too, which is wonderful. A lot of how the testing strips work are, since a lot of substances are being caught with fentanyl, most people don't know if fentanyl is going to be in their substance, whether it's cocaine or marijuana or even heroin itself. Most people do not know. So we have strips where a person can test their substance before they use it. And that is a harm reduction strategy that is proven to save lives. And the theory behind that is if a person comes across a substance and they test it and it shows that there is fentanyl present, the theory is that someone would make different choices. Okay, well, instead of just using what I planned on using, I may make sure someone is with me just in case something happens, or I'll make sure I have Narcan available. So that is kind of really one of our harm reduction approaches. Another thing that we've been seeing rising around the country, even in our community in the Twin Ports, is xylazine. It is not an opioid, but it is something that is just as deadly, if not more deadly, than fentanyl. And so the state of Wisconsin, within the past couple of weeks, I don't know the exact date, but Governor Evers just signed a legislation legalizing xylazine testing strips. So in conjunction with our fentanyl testing strips, our agency also has the resource to distribute the xylazine strips. Again, that's our way of harm reduction. We know someone's going to make these decisions that we don't always agree with, but how, in the eyes of public health and in the eyes of safety, can we have someone make better choices? And so those are additional resources our agency offers at Vivant Health.
Thank you so much. I'm glad to know we have that. And again, just in case you don't know, you can reach out to Leanne at her agency if any of you at any time are interested in accessing some of those resources. And if anybody who is here tonight after this panel ends, discussion ends, is interested in Narcan, Leanne has some here that she could give to you, or if you wish to have that.
Okay. What are some factors that contribute to prescription opioid misuse, abuse in our community? Anyone can start.
I guess from what I see, as far as the police aspect, a lot of it is just kind of the ease of access. You know, if you have a grandma or a parent or a sister that plays sports that was prescribed a painkiller, you know, if they don't use their entire prescription, it's just sitting in the medicine cabinet, and it's pretty easy to go grab. I know people are sharing pills all over the place. When I was in high school, people were sharing their parents' pills all over the place, and that's one aspect. It's not difficult if you know the right, or I guess not the right people. If you know the wrong people, it's not difficult to call somebody and have them sell you a pill for, the last time I checked, the counterfeit Percocets, the blue M30s are going for like either $5 or $10 a pop. So any kid that gets an allowance can go buy a pill for $5, $10, and they're hard to find because they're a pill. So.
Thank you.
Yeah, I guess I'll just add that since we learned that opioids aren't safe, the opioid prescribing nationally has decreased, but unfortunately opioid deaths have not. So the problem, we've done a really good job, as in Minnesota especially, and in other states, but nationally, we've done a really good job of trying to prescribe opioids in a safe way. And unfortunately, that didn't curb the opioid epidemic. So I guess I would just say that yes, you should get rid of your extra pills. They shouldn't be lying around. But the problem, the main problem isn't prescription opioids. The main problem are the illicitly manufactured opioids that people can get for super cheap.
Thank you.
I've really seen that it's evolved a lot in the last many years. When I became very aware of opioid being an issue, because in our unit, when we would receive referrals for drugs, what I used to always like to say is that in Superior, or Douglas County in general, 70% of what we would see is alcohol. 20% was usually, methamphetamine, some opioid, pot, that sort of thing, and the rest was the drug du jour, whatever happened to be at the time, so, the synthetics, et cetera. But one of the observations that we had made is that when more efforts were made to engage in more I don't want to say responsible, but when the paradigm shifted a little bit as far as how opioids were prescribed, people started to seek them out in other ways, and it's really kind of gone from that to something completely different now. And now, just today we received 2 referrals of people that have been taking methamphetamine and fentanyl, and 10 years ago, he never saw that. And so it just, I think sometimes you don't really know where, you kind of see all these factors of kind of how it started, but it has a tendency to evolve, and that's what we have seen.
Thank you.
So I appreciate the comments about, what we're seeing and some of the changes that have happened over the years. And also just to say that one of the things that's really important for any of us in our homes is also that if we have medications that we're using, that we're storing them properly, and that we are disposing of them properly when we're done using them, that we're not keeping them in case something hurts later or whatever. But when we're done with that prescription, if we're done with it, that we dispose of those and we're not keeping those meds around, then they can't be diverted, they can't be accidentally taken by little children who might get their hands on them, or by other folks who are looking for some pills to sell or to use themselves. So in that vein, there's also lock boxes out on the tables out there that you are welcome to take for storing medications. We have Deterra bags, which are drug disposal bags that are safe ways to dispose of medication. It neutralizes the active ingredients in your medications. You add water to this bag, pop your pills or the liquid you have in it, seal it, shake it up, and you can throw it in the garbage, and it is environmentally safe as well. So we have those kinds of resources in our community through the Drug Prevention Coalition. I know Dave also said they've been buying a ton of Narcan. I think the county has some Narcan available, but we certainly as a Drug Prevention Coalition have cases of it. So if people are interested in having those things for their homes, please contact us. Thank you. So kind of going on with our conversation, what age groups do you see are most impacted in our community, and are you seeing any trends with youth?
I can
Anybody?
speak to the work I do. So, I have a little bit different perspective than law enforcement, and than being a physician, but sorry, I'm going to maybe. In the role I have working at Vivant Health, I specifically, the demographic of the population I serve, specifically for overdose education and prevention services, I'm seeing about 19 to 57. I have not had many youth come into my office for our prevention services. It does not mean they're not accessing them elsewhere, but my role specifically, I have not encountered a lot of the youth under 19 population. It's majority 19 to, I would even say 60. I'm seeing a higher rise in the older population.
I think on the law enforcement side, it's about the same. certainly had a couple overdoses that were 15-year-olds, 16-year-olds, but typically it's young adults, I would say probably between early 20s, early 30s.
I looked at our referral data for the last 2 years today, and the vast majority of the folks that we saw were 25 to 45. We had a few outliers, late teens, early 20s, and we actually did have some people in their 60s and 70s. But the vast majority were 25 to 45.
Yeah, and I was going to say, I have not seen a lot of juvenile delinquency kind of referrals for fentanyl among children or juveniles. I have seen it probably in the range of 20 to 40, 20 to 50, something like that. I think that's pretty consistent with what the other panelists have said, but we've seen a lot of cases. A lot of our overdoses especially have been mid to late 20s, early 30s, something like that.
Yeah, I would say we, would echo what everybody says, but I just looked up the data for Wisconsin. So in 2023, we had 1,464 people die from opioids just in the state of Wisconsin. So it's the number one, overdose is the number one reason that people in that age group that everyone has mentioned dies. So that's, far and beyond the number one reason that people in that age group die.
Thank you for that. Moving on, what are the criminal repercussions and at what age? So what if someone is abusing a prescription? What if a 15-year-old is selling?
I should probably take this one. So in Wisconsin, you are an adult for criminal charging purposes at age 17. So if you are charged at age 17 or later, you are in the adult criminal justice system, meaning that if you are convicted of a crime, it's a criminal conviction on your adult record. The possibilities could include payment of fines, jail time, probation, potentially prison, depending on what kind of a case it is or what the factors and circumstances in that case are. For a juvenile, if you're under 17, for the most part, a criminal referral will land you in juvenile court, which is not the same as adult court. A lot of the resources and tools that are available for juvenile court probation or that kind of thing are quite different than adult prison. There are circumstances where if you are above age 14 or 15, depending on the crime and depending on a number of factors, you can be what's called waived into adult court, and that is always going to be on a case-by-case basis. I would say that's pretty rare in this county anyway. It's very rare that I've seen a case that's gotten waived into adult court. There are a couple of exceptions where no matter what age you are, reckless homicide would be the one that's relevant to this discussion. No matter what your age, if you're age 10 or over, you commit the crime of reckless homicide, you are charged as an adult right off the bat. And then there's a mechanism whereby you could go back into juvenile court. I have seen that happen before in a couple of instances, but for the most part, that case stays in adult court because of the seriousness of the crime and the way that it's classified in the statute. So.
Thank you for that. I think a lot of our young people don't realize the ramifications sometimes of some of the things that they're getting involved with. And I have heard in my tenure working with youth over the last 25 or 30 years, I've heard youth say, like, well, I don't think I'll get caught, number one. And number two, if I were to get caught, I'm a kid, so there's not a lot that can happen to me. And I think, again, having people be aware of what some of those ramifications are, particularly in Wisconsin, is important for them to understand that if you make certain decisions, there are certain consequences that could happen as a result of the decisions that you're making.
Definitely. And the things that can happen to you in juvenile court are different than in adult court, but they still could include secure detention, placement in a secure facility. They can include sanctions. It all depends, and the goal of the juvenile justice system is to recognize that young people, their brains aren't fully formed, there's maturity and learning that needs to happen, and we're probably doing more damage than we are good if we lock them up and throw away the key. I think that's not the right thing to do.
Right, thank you, yeah. So that brings me to another question. So I think if any of you could give advice to parents about what's happening with opioid use in our community, what would you say to them? What would you like parents to know, or what would you say to them?
I think the biggest thing is being present and paying attention to, one, your kid, and two, what they're doing. There's plenty of signs that you can pick up on without any sort of special training or experience. If somebody's under the influence of an opioid, their pupils will likely be pinpoint. I guess they're going to be slower in their movements. Once you get into that kind of more the addiction side of things and you're not just experimenting, people's behavior tends to change drastically. So I think that the advice that I would give is be present. I know people don't want to be a helicopter parent, but you also don't want your kid dying in their friend's basement.
Thank you.
I would say that some organizations recommend that there's no age that's too young to start talking to your kids. I mean, parents know their kids the best, so they would probably know when it's the right time, but there isn't a perfect time. But if you don't talk to your kids about substances, then you're sending a message too, right? So talking with kids is really important. That's what the guidelines recommend, and that, there's no perfect time, but just the fact that you made that effort, I think, can speak volumes. And that addiction, I guess I would say that addiction is a family disease, and it is a disease. So I just took my addiction medicine boards, and there's time and time again that it came up that addiction is 50% inherited, right? So many people who have been affected by addiction know that there's almost never someone who just de novo gets addiction, right? It's inherited, and so that's something that people can't control. And then I will say that many people who struggle with addiction have had lots of things that happen to them. So there's lots of trauma that comes along with it. There's lots of mental health that comes along with it. And the disease is really stigmatized. So then when people do try to reach out or get help, they're often mistreated. So I think of it sort of as like adding injury to insult.
Okay, thank you.
My piece of advice would be to look beyond just the bigger picture. A lot of people assume that opioids and fentanyl are only heroin, only meth. They are way out there further than beyond that. A lot of youth think that the stigma of marijuana is great because it's legalized in so many places, but the reality is a lot of these substances are being caught with fentanyl, and so a lot of parents might think, well, it is just pot, so that's, it's better than the alternative, it's better than drinking, it's better than being drunk. But the reality is a lot of these substances we think are safe really aren't. They are changing every day across the country. And things as simple as marijuana and cocaine are killing people. Even as far as last Friday, my colleague in our Eau Claire office told me there was a baggie of fentanyl found in the Chippewa Falls school, the high school. So it was fentanyl residue in a baggie in the high school. So it's really out there, and a lot of people think, oh, it's not going to happen to my child. They're not into heroin. They're not injecting drugs, but it's beyond that. They are being found in simple things like vape cartridges, and a lot of you think it is normal and okay to smoke marijuana, but just to be more aware of the dangers outside of the standard meth and heroin. And then also, it's okay to have honest conversations with our children and coming at it from a non-judgmental frame of mind. I remember when I was a kid growing up, the moment my parents would tell me, no, you cannot do that, you cannot, when you're told not to do something, what are you gonna do? You're gonna do the opposite, right? I know that's how I was when I was growing up. If someone told me no, I would probably do the opposite. And so coming at things from a very non-judgmental, open place is, in my opinion, a great way to start those conversations with our kids.
Just to kind of piggyback off of what Leanne was saying, make sure that you're really driving home how dangerous it is to take something that you don't know exactly what it is. A lot of times our overdoses, people think they're taking just a Lortab from a friend or an ibuprofen or something. And so your family knows it is happening locally. Last year in our community, we had approximately 53 suspected overdoses, and in 22, we had 68 suspected overdoses. So it is happening here local, and just make sure that your family is aware that this is happening and it could happen to you, and really drive home how dangerous it could be, and the consequences are, could be pretty serious.
All right, thank you. I appreciate all of your comments. If anyone would like to add to this, feel free. But we have been working as a drug coalition with a campaign recently for the last couple of years, actually, Smart Talks, which is about underage drinking. And part of the goal of that campaign was to encourage adults, all adults in our community, because for the most part, we all have access to children, to young people, to have those conversations when we have opportunities to about, in that case, underage drinking, but really about any substance use. And it doesn't have to be some big formal event like, we're going to plan this and we're going to have this big family meeting, but taking the opportunity when it arises. If you're driving, in your car with your kids or some young people, and so you see a billboard, or you hear something on the radio, or what do you see? You hear something on the news, and you take the opportunity to have those small talks, like, did you hear that? I'm wondering, what are you seeing at school? What do what's happening with your friends? Is this an issue? So those small talks, really taking those really opportunities when they arise, just naturally to have those conversations and start having those talks so they know. And again, we talked about really being non-judgmental and curious, and open to listen to what they have to say, and know that you may hear something that's uncomfortable or you don't like to hear, but can we keep those channels of communication open? I know recently we're getting a lot of advice to start having those conversations with our children as young as 8 years old, because the onset of use is declining as the years go by. It used to be 15, 16 years old was the age of onset of use, so like for alcohol and other substances. That's now like 11 and 12, and that number continues to drop. So prevention really has to happen early and often. So as often as we can have those conversations and bring awareness to it, and have again, I think, Officer Robinson said it well, be present. Are we watching what's happening with our youth and paying attention? So really key pieces. And I don't know if anybody else would have any from the panel that they'd like to add to that, but I think, Dr. Ripley, in your work, I think and maybe you would agree with this, I think the longer that we can delay onset of use, so if we could prevent somebody from beginning to use alcohol or substances at 12 and 13 and 14, and we can delay that till they're 18, 19, 20, 21, the less likely they are to have substance use problems as adults. So the goal really of prevention is to get the word, to do those things early enough that we can prevent it from happening, or at least delay the onset of use.
Yeah, I will say, it's interesting. I was at the Addiction Medicine Conference last year, and I'm about to go this year. It's at this time. And I asked a bunch of addiction doctors, like, how are we going to prevent addiction? And some people kind of just laughed, So in the United States, like, we don't do a great job at preventive care, right? Just in general. So, like, we're really good when people get advanced diseases, but I mean, every other country is better at preventive care than we are. So I think the same goes for addiction, but how do you, yes, of course, if we can delay substance use, it's going to be better in many ways. Now, can I definitively say, is there research that says that prevents someone from getting a substance use disorder? I don't know. I mean, we know that there's a genetic component. We know that certainly people who grow up in a family where everyone is using, like, those people are gonna use, right? Mm-hmm. And so, yeah, it's really good to try to delay that use, and it's gonna be better for their brains. And I could talk about that all day. Marijuana use when people are younger, and the association with people getting diagnosed with schizophrenia. But I don't think we do a very good job of prevention, but we know that people need connection, people need family, people need, stable parents, they need, good parent relationships, and those things, the same things that are gonna help kids be resilient are gonna be the same things that are gonna help people, not become addicted to drugs.
Thank you.
I guess just to add to some of what we're talking about as far as prevention is concerned, I've been confronted by people over the years who are less than empathetic about or sympathetic for people who are experiencing some of these sorts of things. So I'd like to take it from a little different angle. And personally, I come from a place of sympathy and wanting to assist. But to reach other people, treatment's expensive. It's really expensive. Prevention's cheap. And with just a little bit of prevention, you can stop a whole lot of expense. And I mean, if you just take, for example, somebody who overdoses, they're going to go into the ER, so they have an ER visit, possible hospitalization. Then they contact my office. We start getting involved in legal stuff. We have to do transport. We get them into inpatient treatment. We then do case management. You're talking tens of thousands of dollars for that person's recovery, and I fully endorse it. I think people need that. But then you do something small, like small talks. We were involved with some of that. It's cheap, and it has this huge impact. And there's other programs that have occurred that are all very inexpensive, and unfortunately, a lot of people don't see that. They don't see that these programs that perhaps are not, they don't mean a lot to them, actually do an immense amount of good and prevent all of those much more expensive pieces. So if you're talking to somebody who's more of that framework, prevention's always the best way to go as far as bang for your buck. So throw it out there.
Oh, thank you. Any other comments from anybody about any of that?
I am going to put a quick plug in for our coalition on one last piece. So I am also a member of our Douglas County Drug Prevention Coalition, and we are looking at creating some focus groups, youth focus groups and adult focused, to help with some of the mission of our coalition on some of the projects we're working on. So we do have a sign-up sheet out in the front. So if anyone is interested in wanting to have more of an involvement with the work our coalition is doing, please reach out to myself, Jane, and then we do have the sign-up sheet out front. So, yeah, thank you.
Okay. With it, we have just a few minutes left before we turn it over to some Q&A from our audience members. When overdose happens, we know that there's Narcan available. How easy is it for people, the general public, to get Narcan?
So Narcan has become more accessible as the years have gone by. For example, Jen with the police department, they have adequate stock. Dave with his agency. So with the county level, we're very fully stocked. My agency, we provide Narcan to individuals who use, and then also to family members, community members. So Narcan is actually very accessible to obtain here in our community. Simply give me a call, stop by my office, and we can make sure a person is trained and have access to the Narcan available. We're also one of our trainers that goes around and trains different entities across the state. For example, we assist in training schools to ensure Narcan is on hand for something were to happen. But yeah, simply stop by my table back there or give me a call or an email. We'll make sure someone always has access.
I don't have Narcan with me tonight other than this dose, but I do have some fentanyl testing strips if anyone is interested in those, and I have a booth outside also.
And it may have been mentioned earlier, but we actually did a project where we sent out, I think everybody probably knows about this, you got your Datura bag in the mail. That is a way to make drugs inert and safe to dispose of. We have lots of them in the department, lots of them. All you need to do is come to the 4th floor of the government center, and we'd be happy to supply you with one.
Narcan is over the counter now, so you can, you should be able to go into any pharmacy and just get Narcan. The problem with that is that it's not, if someone is low income, they might not be able to pay for it, so it's always, it might be nice to have a prescription for it, in which case your insurance would pay for it. So, but we are, in general, you can get it over the counter you should be able to get it over the counter at any pharmacy. You should be able to ask any provider, and it should be available anywhere. It should be widely available, so.
Thank you. Do any of you have any final comments that you would like to make before we turn over to Q&A from our audience members? Good. Okay. Do we have any questions from the audience? Do any of you have any questions for our panelists? Okay. We have somebody right down front, Carrie.
I'm going to give you a microphone. Didn't know that when you raised your hand, did you? No, I thank you. How would you, that's really loud. How would you go about explaining to other young children in your home about an older sibling who is in treatment for addiction?
I always tell people that addiction is a disease. So, depending on your level of detail, I would say this person is getting medical care for a medical problem that they have, and they might need intensive groups or behavioral treatment, that they need to be sort of immersed in that environment in order to learn skills and learn strategies to deal with this problem that they have, and they may need time to get through whatever the side effects of that drug are, right? They might be going through withdrawal, and they might need to be supported through that with medications, and that's super uncomfortable and really hard for people to go through. So that takes time and kind of intensive medications. And then I would say that it's a disease that is it's a chronic disease. So much like diabetes, people who have diabetes sometimes eat cake, right? And that doesn't mean that they are a bad person or that they shouldn't receive their medication. But the difference with addiction is that sometimes what people do, the behaviors are just really different, and sometimes people don't understand that. But that is addiction. That's the nature of addiction, and that there are really good treatments for it. There's good medication for it. People do recover from it. We don't really see nice stories of recovery. The news is always telling stories about all these awful things that happen, but people recover, right? Mm-hmm. People, just like any other chronic medical problem, people get better from it. And that it needs, unfortunately, just like any other disease, when one child is sick, I think that child then needs a lot of resources, and I can imagine that's really hard. But I guess being kind of cognizant of that, but that probably isn't going to last forever, and that that's what they need right now, and that addiction then would probably affect the whole family. So there's other resources for the family, like there's community resources like Al-Anon, or whatever resource that the family might want to seek out. So we always tell people, the opposite of addiction is connection. So people just need love. Nobody recovers without love and connection. And so, that stinks. It's hard. It's really hard. But people get better. And hope is really important.
Yeah. Thank you. Yes.
Hi, I'm Bethany Rowe. I'm the president of Pledge Makers here at SHS. We do fun events for high schoolers and who pledge to be drug and alcohol free throughout their high school career. My question is, what is like Superior? What are we doing to prevent like vape shops and like IDs just like not being used in like those vape shops, and also just like an increase of vape shops in our community since the past 10 years even?
So that's kind of a tricky question. First of all, good for you. It's not easy to go through high school and avoid all that sort of temptation, so congratulations. As far as the vape shops, is your question specifically about vape shops? Okay. The difficult thing is, I know that recently, I think federally, they raised the age to 21, I believe. We, as the police department, don't enforce federal laws, and we did have a time where we tried to clamp down on selling to 18, 19-year-olds, and then they quickly called a lawyer, and we can't, apparently there's not much we can do at this moment about that. But I think that with vaping, tobacco use, any other substance use, I think that ultimately it kind of starts at home. I think that, again, it's hard to avoid temptation. You know, your friends are walking around with their little robot cigarette and it looks cool, and you're like, oh, I want to try that. But ultimately it starts at home, and I think that if we have any parents here, I think the same thing that I said earlier about being present. I don't know that maybe in the near future we'll be able to do something about that, because I do think that there's some harmful stuff that happens to developing bodies that are ingesting foreign chemicals. But specifically to your question, and maybe Mark has a better answer, but there's not anything that we can do about them selling to people under 21 at this moment in time.
I don't have a better answer, unfortunately. I think it's largely a political question or a civil question that has to do with what businesses can come into a community, you know, how they can get the property, what they can sell. That is a legislative issue that needs to be dealt with at the state level. There's not a whole lot, unfortunately, that I think that local officials can do about that. I honestly don't know a lot because I'm not in the civil realm at all. I'm in the criminal realm, but I think that it's largely a political issue.
I'm glad you asked the question, and I think, you know, there's a couple levels to that question, right? So we have a difference between federal law and what our state says is allowable to happen in our state. So our officers are kind of stuck with not being able to enforce what is a federal law. But I think the fact that you asked the question is really important. You are a young person, and the fact that you care about that and you want to do something about that and you're asking what that can look like is powerful, because people listen to you. As young people, you have power to come together. If you don't like something, you can come together, and we have local officials you can approach. We have our planning commission within our cities. You know, we have the city has the power to limit like numbers of different kinds of businesses that open. How many bars do we have, or where can these places be located? So I think the fact that you're even asking the question and you represent a group of students at the high school who are interested in this issue and others like that is huge, because together you can come and talk to the adults and say, we're kids and we're concerned about this, and we're concerned about like how many vape shops there are or where they're located, and kids are getting stuff at vape shops or whatever. You can take your stories to our local officials, and they're going to listen to you more than they're going to listen to us. So I think kudos to you. Thank you for asking. Thank you for being concerned. And you have some power here with your collective group to have an impact in our community. So I would encourage you to continue having those conversations and working with adults who can help you get connected with people at the city level to help you do that. Yeah.
Good for you. Good for you.
I just have a question about the likelihood of becoming addicted. Have somebody try it, or it's cut into something like marijuana? And is it likely that, my generation, we were always told that if you tried heroin like that, that one time, that could get you addicted for life. And I'm just wondering if it's still that kind of a thing, with them being synthetic, or, they're man-made now. Is it that same kind of thing where they accidentally, somebody accidentally tries it, or, ingests it or smokes it or whatever they do with it? Is it likely that that is going to become an addiction?
I would say no. So I'm trying to think off the top of my head, what do I know? So we know that somewhere between 20 to 30% of people who are prescribed opioids chronically will end up with a use disorder. And I'm not sure that that could be extrapolated to any, drug. But the point is that many, many people use alcohol in a way that doesn't become problematic. And many people will probably use drugs and they don't get addicted. So some proportion of people will become addicted. It's not the majority. So, but I always tell people there's a difference between, like, say you used, sometimes what happens, what Leanne was saying, is that sometimes some of the substances, like someone may use meth chronically, and that meth might have fentanyl in it, and then they might have become dependent on it, which is different from an addiction, right? So like I always tell people, like, I drink coffee every day. If I don't drink coffee, I get a headache. Like, I'm dependent on it, but I'm not addicted to it. So you could, if you used something every day, your body's gonna get used to it. You'll become dependent on it. That's different from addiction.
Just to kind of add, probably the bigger danger, especially for somebody experimenting, is accidental overdose. And that's something that should always be considered. The amount that one person can use can be very different than what another person can use. Or if someone is used to a certain level of use, discontinues and starts again, they could very well overdose. Though that's one of the bigger risks that's really out there for first-time users.
Are they still prescribing opioids to youth? The reason why I ask is because I
It's okay, take your time. Yeah, I mean, I see patients not every day, but I mean, just today I saw a patient who, same thing. Patient was prescribed opioids back in 2010 for back pain. And then, it became a problem. And now here we are. And so I'm really sorry, I'm really sorry that happened, and that it's so hard. And I totally understand the anger. I would say that's not, there are many, like I said, there's lots of people, the majority of people are prescribed opioids and they can take them and there's no problem. But there are some people who that does happen, right? Obviously it happens, it happened to you. So when we prescribe opioids, we are pretty strict with them, right? We have really strict guidelines. How many opioids do we prescribe for postoperative pain? And I think it's becoming more and more stringent, and there's a whole community of people who feel like the pendulum has swung too far, right? Like we are terrible and we won't give opioids, and so there's people on all ends of the spectrum. So yes, if someone has a broken bone, they're probably going to get a prescription for opioids. Yeah, that's a hard question. I will say, I think we're doing better. I think even in my short career, something that's really hard for people to conceptualize is that, so, you know, just if we just take the opioid epidemic in a snapshot, right? Purdue said, you can give opioids, they're safe. This was based on like one little study that actually had no evidence, right? And then the drug companies like came up with the pain scale and they said, you know, you have a right to get your pain treated. And then, so we gave everybody opioids and then we were like, oh wait, no, this isn't safe. Let's put in all these guidelines. And so doctors have these scorecards, right? And so doctors get these scorecards, say, you're over-prescribing. So then doctors don't want to prescribe, right? Because they're afraid. They're afraid that they don't want to prescribe. So then they stop prescribing. But we know that, you know, 20 to 30% of the people that they prescribed opioids to are going to develop an opioid use disorder. But then did we implement really good programs to train those doctors to then first recognize the people who are misusing and then offer them treatment? No, we didn't, right? So then what they did is they cut people off and then people died, you know, because then they did what they needed to do because going through opioid withdrawal is super uncomfortable and it's awful. And so then, you know, patients did what they had to do to feel normal, which was turn to, you know. So I think we're trying to do a better job of recognizing when someone is misusing their drugs, their prescribed drugs, and then trying to offer them treatment. But I mean, it's a big lift.
I would also add that the companies that manufactured the drugs have a role in that as well. That's why you see so much opioid settlement money coming through, and I mean, actually Douglas County got some opioid settlement money as well to help with prevention and treatment, and I think that was also a big piece of it.
Thank you. Did we have any questions coming in from anybody online or who is from the street folks who are watching from home? No? Okay. Do we have any other questions here from folks?
My microphone is working again. We changed the batteries just when you had.
Okay, hi. So throughout your presentation, thank you all for being here. But I don't think I heard one mention of mental health being a contributing factor, and I think that it's at least a moderate correlation with addiction and substance use. What resources are there in our community for lower income youth or people who maybe don't know where to go or who to talk to? Because without addressing that, which is a concern, you're not really solving the problem.
I can say that you're absolutely right. Mental health is a big piece of it, and it's a struggle for us too, whether or not we try to treat the mental health first or the substance use disorder. But part of our job at the police department and doing active outreach is we try to connect folks to whatever resources we do have in the community. We work with Essentia, we work with Douglas County, we work with Vivant, for whatever this person needs to try to get them connected, whether it's to HDC or whether it's to NAMI or whether it's to a peer support or the adult partial program. I know last fall I got a 17-year-old came across my desk, and all I could really do at the time was just give her support, you know, reach out to her, talk to her, help her with resources, what she needs, connect her to a peer, and then signed her up for our treatment program. Part of our Pathways to Hope program does also include a mental health piece. But you're absolutely right. It is part of the problem, and it is a struggle for sure. Thanks for bringing that up.
And unfortunately, that is a combination that has not been addressed well by a number of resources. And in fact, I would say there's only a handful of actual facilities that are equipped to, or at least have the proper training to work with that very issue. And it's become a legislative issue many times, and we've done some advocacy trying to find more programs. The state is recognizing the need, and I do hear about different efforts, but unfortunately those wheels are oftentimes very slow. As far as why is it slow, or is it why is it, could you be a little more specific? Yeah. Anything legislative takes a long time. And I don't have a good answer for that, aside from throughout my career, I've seen that. And I think oftentimes when you start referring to people who both have significant mental health concerns as well as drug addiction, their needs are very specialized compared to someone that might just have one or the other. And a lot of times providers aren't comfortable treating both at the same time. And I think there's been a real push to educate providers into doing that and to actually create unique programs to train the people to work with such groups. I sincerely believe 10, 15 years from now, it'll be a different story.
I will say that I guess this might help out a little bit. Me and Jen are on our drug court team for the county, and also through Pathways to Hope. A lot of people, like you said, have both the mental health piece and the addiction piece. And in drug court, and even in people that are on probation or parole, a lot of times the majority of the response is trying to exhaust every option to try to help them before it ends up being a sit in prison for an extended period of time. So I can tell you that there's people that are on drug court or on probation that are, being put into inpatient treatment or being put into mental health treatment or counseling that's specific to their needs. It's not an umbrella approach that's really touching everyone, but I'm assuming that people sitting out here don't necessarily know that that's happening. So I will tell you that that is being addressed, at least on that micro level, for those people.
I kind of have a follow-up question to that. As I believe Dave said, that the cost of treatment is very, very expensive. Doesn't that kind of put people on a perpetual cycle? Or doesn't that have the opportunity? Because you're in up to your eyeballs in debt on this and just drowning and going back to using as an escape?
That's certainly a possibility. I think that, part of the issue one of the issues that we deal with trying to get people into treatment is, whether or not they have insurance or if their insurance will cover either all of it or part of it or whatever the case is. And any delay in getting the appropriate treatment or the appropriate mitigation for the issue is probably going to result in prolonged use or use longer. But there's not really a magic bullet for it. And unfortunately, in America, everything costs money. So it's going to come out of their pocket, it's going to come out of the insurance's pocket, and ultimately, as the taxpayer, when we have any sort of social program that comes out, it's probably going to come out of our pockets as well. So I think that as far as the financial aspect goes, it's a priorities thing, right? I personally don't have an issue with paying more money if it means that somebody gets the treatment they need and then they're no longer suffering from addiction, or they are in prolonged recovery and not generating 911 calls. They're not victimizing their neighbor. So I think that it comes down to priorities and kind of realizing what you think success is. Personally, the money part doesn't necessarily affect me because I don't think that I can put a price on what I think is appropriate for saving someone's life, right? if we didn't spend all the money we spend on, I'll tell a quick story. I think we're running out of time, but recently there was not recently, it was probably a year or two ago. There was a 15-year-old girl that overdosed. She ended up in a car. They're rushing to the hospital. There's like 4 underage girls in this car. They were leaving a house with one of their friends who, there was an adult there, if you're wondering. But me and my partners had to race across the city, right? So the money we're looking at is the Narcan that we have, which isn't free, the cars that we're driving, 5 cops. So if we don't spend money on things, we don't get there and we don't save this girl's life and get her to the hospital. So when I look at addiction, especially opioid addiction, even methamphetamine, right, because you can die from a methamphetamine overdose, I think that for me, because obviously I'm not the one spending millions of dollars, but the price point doesn't matter for me because I'm more interested in making sure that people are staying alive. So,
Well said.
And I would like to be able to add too that even though we don't have a mental health professional on our panel of experts, we do have experts within our community and some in our audience and tabling tonight as well. So I'm wondering if you can talk a little bit about your expertise.
Hi, I'm Emily. I'm a therapist with Encouragement Clinic in Superior. We have our wonderful owner, Karina, with us. My specialty is working with individuals with both mental health and a substance use disorder, and I work both with 12 and up. So I see a lot of families come in, a lot of teens, specifically a lot of people coming out of jail that are just having a really hard time finding resources to stay sober. So I want to address the mental health piece and just saying when there's good ongoing care, one, there's a huge need for providers. I totally agree with what Dave said about some providers just don't necessarily feel comfortable treating both. I like to add that the substance use piece is also very, very similar to the mental health piece. They're both kind of diagnosed the same. So not that I treat them the same, but there tends to be a huge overlap that the mental health piece is really crucial in order for people to stay sober. One more thing I would like to add to the clinic was privileged the last couple years to receive a grant through the city of Superior, which allowed us to see teens in the middle school and the high school underneath the grant, which kind of filled some of the financial need as well. So when it's not accessible or it's too expensive or we're running into issues with Badger Care, we were able to see teens access care a little bit easier.
All right. Well, I thank you, everyone, again, just for the opportunity to have all of you here as our panelists. Please know that we're very grateful for you taking the time out of your evenings to come and join us tonight. We thought this was an important issue that we needed to take the opportunity when we had to address locally, to bring our local experts in to talk about what are we seeing, what are we experiencing in our own community, what are some of the resources we have, what are some of the things that we can do, everything from, knowing what warning signs are to having those conversations to proper medication storage and disposal, all of the things we've talked about, and that we do have opportunities for services in our community. And we know this is an ongoing issue. It's not going to go away tomorrow. And it's an ongoing, I think, challenge to have the services that we need available for everybody who needs them. So again, it's the effort of everybody coming together, whether that's advocating for change, for the things that we need, supporting one another and our families in our community as we work through some of these challenges that we experience and face. So thank you all for being here with us this evening. I would encourage you, if you didn't have a chance to stop by the tables, they are still set up out there. There's a lot of resources and materials available for you that you are free to take. Again, the Douglas County Drug Prevention Coalition, if you would like to know more about that, Leanne has some sheets at her table that you could leave your name, an email address if you'd like to know more or be part of those focus groups. to have some conversations about what are you seeing about some specific use in our community that the coalition is working on. So again, please accept our gratitude for your time to be with us this evening, and thank you to all of our panelists, and maybe we could give them a round of applause. If any of you have questions after this, we'll be here, or we'll actually be out there, so feel free to approach any of us if you'd like to. Again, thank you.
Yeah, thank you so much. And then, Leanne, what about the drawing? Yeah, so there's a gift basket and a bunch of fresh bread from Duluth's Best Bread. So if you get that, that was baked today.
Yay.
Thank you so much. Thank you.